84% of adults with irritable bowel syndrome test positive for small intestinal bacterial overgrowth, SIBO. Yet fewer than 5% of seniors with chronic bloating, gas, and abdominal discomfort have ever been tested for it. Your doctor says it is just your age, your diet, your stress. They prescribe antacids or tell you to eat more fiber. The bloating gets worse. A 2022 study in Digestive Diseases and Sciences found that SIBO prevalence in adults over 65 was 3 to 5 times higher than in younger adults, largely because of slowed gut motility, low stomach acid, and proton pump inhibitor use. You have a treatable bacterial overgrowth in your small intestine. Nobody tested for it, and the treatments you are receiving may be feeding the bacteria instead of fighting them. I'm Dr. Rosalind Keller, 36 years in family medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. It is 2 o'clock in the afternoon. Your belly is distended. You look 6 months pregnant. You were fine at breakfast. By lunch, the bloating started. Now you are uncomfortable sitting. Your waistband is cutting into your skin. You unbutton your pants. Gas builds. You are embarrassed. You cannot go to your friend's house for cards because you are afraid of what your body will do in a quiet room. You have been dealing with this for months, maybe years. You have tried cutting dairy. You tried cutting gluten. You tried eating smaller meals. Nothing works. You assume your digestive system is just falling apart with age. It is not. Something specific is happening in a specific part of your gut, and it has a name. SIBO stands for small intestinal bacterial overgrowth. Your small intestine is supposed to have relatively few bacteria. The large intestine, your colon, is where the heavy bacterial population lives. Between meals, your small intestine performs a cleaning wave called the migrating motor complex. It sweeps bacteria and food debris from the small intestine down into the colon. Think of it like a self-cleaning oven cycle. After 65, this cleaning wave slows down. PPI medications suppress stomach acid, which is your first line of bacterial defense. Slow motility plus low acid means bacteria from the colon migrate upward into the small intestine and set up camp. When you eat, especially carbohydrates and fiber, these misplaced bacteria ferment the food in the wrong location. The fermentation produces hydrogen and methane gas. Your small intestine was not designed to handle this gas production. It swells. You bloat. You pass gas excessively. You may develop diarrhea, constipation, or alternating between both. And because the bacteria are consuming your nutrients before you can absorb them, you may develop deficiencies in B12, iron, and fat-soluble vitamins, despite eating a healthy diet. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin, you take blood thinners like Eliquis or warfarin, you take a diuretic, you take a proton pump inhibitor like omeprazole, you have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. Let me tell you about Doris. Doris was 71 years old, retired hairdresser from Spokane, Washington. Doris had been bloated after every meal for 3 years. She described her belly as a balloon by afternoon. She had gas 20 to 30 times a day. She was constipated 4 days a week. Her doctor told her to eat more fiber. The fiber made the bloating worse. He told her to take a probiotic. The probiotic made the gas worse. He prescribed omeprazole for what he assumed was acid reflux causing the discomfort. The omeprazole made everything worse because it reduced the stomach acid that was her last defense against upward bacterial migration. Doris stopped going out to eat. She stopped visiting friends. She wore loose clothing every day. When Doris finally saw a gastroenterologist, he ordered a lactulose breath test. She drank a sugar solution and breathed into a collection device every 20 minutes for 3 hours. The test measured hydrogen and methane in her breath. Elevated hydrogen at 60 minutes confirmed SIBO. The bacteria were in her small intestine, fermenting her food before she could digest it. The gastroenterologist prescribed a 2-week course of rifaximin, an antibiotic that targets small intestinal bacteria specifically. Within 10 days, Doris's bloating decreased by 70%. She cried in the follow-up appointment. 3 years of suffering, 1 breath test, 2 weeks of treatment. Here is your first self-assessment. Answer these questions. Do you bloat significantly after most meals, especially meals containing bread, pasta, or legumes? Does the bloating get progressively worse throughout the day and resolve overnight? Do you have excessive gas, more than 15 times per day? Do you alternate between diarrhea and constipation with no clear pattern? Have fiber supplements or probiotics made your symptoms worse? If you answered yes to 3 or more of these, SIBO is a likely contributor to your symptoms. Here is your second assessment. Check your risk factors. Are you over 65? Do you take a proton pump inhibitor? Have you had abdominal surgery, including appendectomy or gallbladder removal? Do you have diabetes, which slows gut motility? Have you taken multiple courses of antibiotics in the past 2 years? Do you take opioid pain medications, which slow gut movement? Each of these increases SIBO risk. 3 or more risk factors make SIBO highly probable in the presence of chronic bloating. Things that make SIBO worse. First, fiber supplements. This seems counterintuitive, but adding fiber feeds the bacteria in your small intestine. More fuel for fermentation means more gas and bloating. If fiber makes you worse, that is a SIBO red flag. Second, certain probiotics. Lactobacillus-based probiotics can worsen SIBO by adding bacteria to an already overgrown environment. Not all probiotics are appropriate for SIBO. Third, sugar and refined carbohydrates. These are the fastest fuel for bacterial fermentation. Fourth, grazing or snacking between meals. The migrating motor complex, the cleaning wave, only activates during fasting periods. If you eat every 2 to 3 hours, the cleaning wave never runs. The bacteria are never swept out. Here is what helps. First, meal spacing. Eat 3 meals per day with at least 4 to 5 hours between meals. No snacking. This allows the migrating motor complex to activate and sweep bacteria out of the small intestine. Second, ginger. Fresh ginger tea or ginger capsules stimulate the migrating motor complex. 1 cup of fresh ginger tea 30 minutes after dinner promotes the cleaning wave during the overnight fast. Third, apple cider vinegar. 1 tablespoon in water before meals increases stomach acid, which helps prevent bacteria from migrating upward. Fourth, cooked vegetables instead of raw. Cooking breaks down the fiber that bacteria ferment. Raw vegetables and salads may worsen SIBO symptoms. Steaming, roasting, or sautéing reduces the fermentable fiber content while keeping the nutrients intact. This is the Keller SIBO protocol. Step 1. Ask your gastroenterologist for a lactulose breath test. This is the standard diagnostic test for SIBO. It is non-invasive, takes 3 hours, and is widely available. If your doctor is unfamiliar with SIBO testing, ask for a referral to a gastroenterologist who specializes in motility disorders. Step 2. While waiting for testing, Space your meals 4 to 5 hours apart with no snacking. Drink ginger tea after dinner. These 2 changes reduce bacterial feeding time and promote the cleaning wave. Step 3. If SIBO is confirmed, the standard treatment is rifaximin 550 milligrams 3 times daily for 14 days. This antibiotic has minimal systemic absorption and targets small intestinal bacteria specifically. Recurrence is common, so follow-up testing and prevention strategies are essential. Doris completed her rifaximin course and followed the meal spacing protocol. She drinks ginger tea every evening. She stopped the fiber supplement and the probiotic that were making her worse. She asked her gastroenterologist about tapering her omeprazole, which was a major contributor. At her 6-month follow-up, her breath test was negative. No SIBO. Her bloating was gone. She returned to her COD group. She went out to dinner with her daughter for the first time in 2 years. She told me that 3 years of misery ended with a breath test and 14 pills a day for 2 weeks. She was angry nobody suggested it sooner. She had a right to be. Write your age below, and tell me, how long has your belly been giving you trouble? I read every comment. Here are your 5 takeaways. 1. SIBO causes bloating, gas, and bowel changes by placing bacteria in the wrong part of your gut. 2. Fiber and certain probiotics can make SIBO worse. 3. Space meals 4 to 5 hours apart to activate the gut's self-cleaning wave. 4. Ask your gastroenterologist for a lactulose breath test. 5. Rifaximin is the targeted treatment and works within 2 weeks for most patients. This is the conversation your appointment never had time for. The question you wrote down and then crossed out in the waiting room. I don't sell anything. I don't have a practice. I profit from you not needing me. You deserve answers without embarrassment. I'll see you in the next one.